Hey, I'm Dentist Jess. I'm a general dentist, and I find that more often than not, one of the most common questions that I get asked is, hey doc, why do my gums bleed when I floss? Or even just why do my gums bleed in general? So I'm here today to give you a list of the 9 most common reasons that your gums may be bleeding and what you can do about it. Let's jump right in. So, number 1, the first and most common by far reason that our gums bleed is because we're not flossing. It's usually a sign of inflammation and infection, and what we as dentists call, and what you've heard I'm sure on every toothpaste commercial out there, is you have something called gingivitis. Gingivitis being an inflammation and infection going on in your gingiva, which is your gums. So the number 1 reason that most people have bleeding gums is because you're actually not flossing enough. You need to floss. If you floss daily, I promise it will start to get better. Your gums shouldn't bleed. It's not normal to have your gums bleeding. It's not healthy to have them bleeding. So the number 1 reason that gums are bleeding is because you are actually not flossing or brushing or getting rid of any of that inflammation that's going on in the gum tissue. So the first reason is gingivitis. We have that inflammation going on in our gums that we need to clean out, that we need to properly remove that bacteria, that plaque. Check out, I have 2 more videos posted on how to brush your teeth and how to floss your teeth, so make sure you check those out. Our gums shouldn't bleed. It's not healthy for them to be bleeding. Reason number 2, and this one's a little bit less common, but the second reason that your gums may be bleeding is that you actually have a toothbrush that's just too hard, or you're pushing too hard. When you're brushing your teeth, you want to make sure that you're using the softest toothbrush that you can find, really soft bristles, and you want to be really, really gentle with it. Your gums like to be massaged, not sanded. So make sure that you're brushing really, really gently. That can help prevent your gums from bleeding. Number 3, so the third reason that our gums can bleed is that you actually just started flossing. So a lot of people think that flossing is what's making their gums bleed. It's not. Your gums were already inflamed and infected. It's just that flossing them can increase you noticing that your gums are inflamed. So it's increasing this bleeding. So if you've just recently started flossing or you haven't been doing it very long, don't be alarmed. There's a good chance your gums are gonna bleed. If you can just push past that and keep going, keep flossing, they should resolve and the bleeding should stop. Number 4, the fourth reason that a lot of people's gums can bleed, and again, this one isn't as common, but it can occur if you're taking certain medications. So certain medications such as blood thinners increase your risk for bleeding overall, so there's an increased chance that your gums could bleed from them as well. Number 5, this one's for all of you females out there. Pregnancy gingivitis is a real thing. A lot of the times when women are pregnant, your gums can become a lot more sore, tender, inflamed. They can start to bleed a lot more. It might be important to get cleanings done more regularly at your dentist, as well as really upping your oral hygiene. I know that it can be painful and tender. Sometimes this can actually even align not even just with pregnancy, but with women on their monthly cycle. You can have a couple days where your gums just bleed a little bit more. Again, flossing and keeping them clean isn't gonna harm you. It's actually gonna help. It's like having a wound. You wanna have it clean. You don't wanna have food and bacteria and plaque stuck in there. So keep up with your oral hygiene. That can help to prevent any further damage to those tissues. Number 6, now this one is for patients who wear dentures. If your denture doesn't fit properly, you actually can have the gums and the tissues underneath the dentures get ulcers and sores, and they can rub and they can start to bleed. If that's happening, that means that you need to go visit your dentist because your denture needs to be realigned or it needs to be altered so that it fits properly so that you're not getting those sores or ulcers in your mouth. Your gums shouldn't be bleeding if you're wearing dentures, and if they are, it's probably time to get those dentures checked out. Number 7, so number 7 is if you have had dental work done, sometimes it might be a little bit faulty. So you might have a filling that's a little over-contoured, or a crown that's a little too bulky, or maybe a filling that's going down a little bit and it's actually damaging the gum tissue. So again, not a super common cause, but it can happen. If you do find that you're really brushing every day, flossing every day, you're taking really good care using mouthwash, and you still have one certain spot in your gums that just really is irritated over time, make sure you go see your dentist, and they might need to adjust that filling or check the crown, make sure that it's not damaging those tissues around it. Number 8 is linked to chronic diseases. So sometimes our gums actually bleed because there's something else going on in our body. Again, our mouth is connected to our body. Everything is interconnected. So if you're doing a good job brushing and flossing and using mouthwash and your gums are still bleeding a lot, or you have a lot of sores in your mouth, it might be time to follow up with your physician. Diseases such as diabetes are really highly linked with the health of your gum tissue, as well as hemophilia, von Willebrand factor disease, certain leukemias, thrombocytopenia. Those kind of diseases are really highly correlated with your gum health. So if you're finding that your gums are bleeding a lot, or you're really on your oral hygiene and they're still bothering you, you might need to follow up with your physician on that one. Number 9. So number 9 is a lack of certain vitamins. Again, not super common. Not a lot of us are getting scurvy these days. However, there is a lack of vitamin C and a lack of vitamin K linked to gum disease. So if you're missing either of these in your diet, if you're not eating a lot of oranges or limes like they did back in the pirate days, you could have gum inflammation, tenderness, bleeding, that kind of thing linked to it. Vitamin K is really important for blood clotting, and vitamin C is used a lot to help build tissues. It's used in the development of collagen and building the structures that help to keep our gums healthy and our bone and our teeth all anchored in place. So if you're missing some of those vitamins in your diet, it could also contribute to your gums bleeding a little bit. So, just as a recap, bleeding gums is not normal. It's never normal. It shouldn't happen. If it is happening, there's something going on. Again, most typically it is the result of not cleaning properly. We have that inflammation, that infection going on in the gum tissue. The best way to treat that is to brush properly and floss properly. So to make sure to check out my other videos, I have one on how to brush and one on how to floss properly, and incorporate that into your daily routine. 99% of the time, just taking care of your gums and brushing and flossing will help to decrease that bleeding. Keep in mind, bleeding gums is not normal. It's never normal. So if they are bleeding a lot, if you're taking the steps to take care of them, maybe follow up with your health provider and make sure that there's not some underlying disease or condition going on. But yeah, starting off with taking care of your flossing, brushing, daily routine is a great place to start. Alright, so that brings us to the end of today's video on why your gums bleed. If you have any more questions, feel free to comment below. Hit that subscribe button, give me a thumbs up, ring that bell, and tell your friends and family. I'd love to be able to teach you more on this topic. Also, check out my videos on how to brush properly and how to floss properly for more info on that. We'll see you next time.